Hello and welcome. My name is Hugo and I'm a physical therapist. This video has got you covered for all you need to know about the basic anatomy of the knee joint. Starting off, the knee is a synovial joint, meaning that it is meant for movement. The articulate surfaces of the bone are covered in cartilage that ease movement. Further easing movement, there is synovial fluid that acts as a lubricant for the bones, which is later encapsulated by the joint capsule to keep it separated from the rest of the body. The knee is a modified hinge joint, meaning that it can bend and extend like a hinge, but also twist. It can perform about 140 degrees of bending or flexion and can be extended up to 0 degrees or neutral point. If the knee is slightly bent, it can also perform external rotation for about 45 degrees and internal rotation for about 25 degrees. The bones that make up the knee joint is the kneecap, or in Latin patella, and the thigh bone, or in Latin the femur, and the shin bone, or in Latin tibia. Slightly to the side there is also a smaller bone called the fibula that doesn't articulate to the other bones. Where the kneecap or the patella meets the femur bone is called pars femoropatellaris, and where the femur and tibia articulate towards another is called pates femorotibialis. To keep the bone stable, there are 4 major ligaments to the knee, starting off with the side ligaments or the collateral ligaments positioned on each side of the knee joint. First of all, we have the lateral collateral ligament, or the LCL, stopping lateral force to the knee, or varus force. On the other side, we have the medial collateral ligament stopping medial force, or valgus force. Inside the knee joint, there are 2 ligaments laying almost as a cross towards another, thereby giving it the name ligamentum cruciatum in Latin, as of their resemblance to a cross. At the anterior cruciate ligament, or the ACL, stopping anterior movement of the tibia in relation to the femur, and we have the posterior cruciate ligament stopping posterior force to the tibia in relation to the femur. If you feel unsure in which direction the cruciate ligaments go, then you can put your hands on your knees and making the fingers crossed movement on each side of the knee with your palm facing the knee, and you can see that the anterior cruciate ligament goes from the lateral side to the medial side, and vice versa for the posterior cruciate ligament. Another soft tissue that acts as a stabilizing mechanism but also as a cushioning is the meniscus. It lays as a C formation both on the medial side and also on the lateral side. The anterior muscles, or the thigh muscles on the front side of your leg, is called the quadriceps, or in Latin the quad, 4, and ceps meaning heads, meaning the 4 heads of the thigh performing extension of the knee joint. The 4 quadriceps muscles are called the vastus lateralis, vastus medialis, rectus femoris, and also vastus intermedialis. On the back side of your thigh there are a muscle group called the hamstrings that perform flexion of the knee joint, getting their name from the Old English ham, meaning hollow or the bend, and string, meaning ligament or tendon. The hamstrings consist of the biceps femoris that perform flexion and external rotation of the knee. We have the semimembranosus that perform flexion but internal rotation of the knee, and the semitendinosus, which has the same function as the semimembranosus. One of the calf muscles, known as the gastrocnemius, also originates from above the knee, meaning that when it is activated, it performs flexion of the knee. There are 3 more muscles having minor accessory movement to the knee. The first of them is called the popliteus, that lies on the posterior side of the knee joint, performing or aiding in flexion and also internal rotation of the knee joint. We have the sartorius muscle that also aids in both flexion of the knee joint and internal rotation. And we have the gracilis muscle that is aiding in the same movements, flexion and internal rotation. And there you have it. That just about sums it up for all you need to know about the beginner's introduction to knee anatomy. I hope you liked this video, and don't forget to like, comment and subscribe.